Hello everyone, I welcome you all for today's session. I welcome the batch, the second Prof Buster 2.0. The highlight of this batch is integration. And today's system, the integrated system, is central nervous system. We have already started this system yesterday and we have completed from pathology. First, let me orient you, as many students are new, let me orient what do you mean by integration. Again and again I say the highlight of this batch is integration. What do you mean by integration? So like all other systems, the central nervous system, I am going to teach you in an integrated way from pathology, microbiology and pharmacology. So first, in pathology, we have already covered the disorders of central nervous system and tumors of central nervous system in pathology. I hope you have watched that. Today in microbiology, I am going to teach you the microorganisms which cause infection in central nervous system. So in microbiology, we will see 24 organisms there. And after that, we will come on pharmacology, in which we will see the drugs acting on central nervous system. Many drugs we will see: anti-Parkinsonian, anti-epileptic, anti-psychiatric, antidepressants, anti-mania, sedatives, hypnotics, opioids. All these drugs we will see in pharmacology, and we will integrate the three subjects, central nervous system, with each other for better retention, for better understanding. This is the best way you can study the second Prof 3 subjects in integration. So today's session is microbiology. And as I told you, in microbiology, I am going to cover 24 microorganisms which cause infection in central nervous system. So let me introduce the concept of master charts. Okay, so I teach microbiology in a unique way, the systemic microbiology, and I call this unique way as master chart. And I want all of you to get adopted with the system if you are following my sessions. You have to make master charts with me. So as I told you, there are 24 microorganisms. Who are they? There are 9 bacteria, 7 viruses, 7 parasites, and 1 fungus, total 24 organisms, along with 2 syndromes in central nervous system. So first of all is the classification. This is how you can make the classification. I have given a typical color coding. You can watch the session further to understand the color coding. Here the color coding is green color for central nervous system. You can see, as I'm telling you, these are the syndromes. These are the 9 bacteria. These are the 7 parasites, 7 virus, and 1 fungus. You can appreciate total 24 organisms. You have to write like this. The first and the foremost step to learn these 24 organisms, hang it on your wall. Make a calendar, make a master chart and hang it on your wall. And the second thing, one by one, I will take these organisms, some of them today, some of them tomorrow. You have to make comparative columns, the comparative charts between them. And you have to make these comparative columns. For example, on this page, the 3 bacteria, the first 3 bacteria are compared under a fixed set of heading, and that's master chart. You have to hang it on your wall. Okay, the 3 organisms on one page you can take. Okay, if you are having more space, you can take more also. So you have to divide the page in columns. This is the fixed set of heading. You can see introduction, morphology, culture, biochemical reaction, virulence factor, mode of transmission, clinical features, lab diagnosis, treatment, as well as prevention. I hope you can see. Okay, you can appreciate the diagrams are also given over there. You can draw the diagrams as many as you can. This is the best way. Please take my words seriously. This is the only way, not the best way. You can retain microbiology. Otherwise, it's a very volatile subject. You read one organism, you retain it, you reach on the other, the first one is evaporated. That's you all have experienced. If you want to retain it till your NEET, PG or competitive exam, you have to make these columns. Now you can revise the morphology altogether. You can revise the culture media altogether. You can revise the virulence altogether in a comparative way. So 3 organisms on one page. This is how total 24 organisms we are going to compare. So you have to make these master chart. Take out your big notebook, pan, different color pan, and divide it into columns as I'm instructing you, and make these master charts with me. Okay, and if you are having less time, many students have exam just ahead and you don't have to time to make it. The ready-made version is available on our website. You can order it, but I prefer you should make of your own if you want better retention. This one is made by me, okay, based on my lectures. So I'm having the retention, but if you want your retention, you should make by your own. But if you have the less time, you can order it from the website. The next unique thing in these lectures, which are different from the previous year recording 1.0, is the MCQs. We have inserted MCQs after every organism. So you will get 24 sets of MCQ. After every organism, there is a set of MCQ, except the minor organism. And you have to attempt those MCQ to analyze yourself how much you have learned in the video. So watch the video, make the master chart simultaneously. At the end of any organism, any disorder, there is a set of MCQ and you have to attempt that. Okay, and cherry on the top, I'm super excited to announce that now Microbiology Prof Buster book, hard copy book is also available. Okay, as thousands of students have requested that they want the hard copy book, what I'm teaching. So this book contains slide to slide, word to word of my videos. Whatever I'm teaching you in these videos, slide to slide, word to word is given in these books. In this book, you can see with, the color coding I'm following with high definition images, everything is given. So if you want to watch the video and mark simultaneously in the hard copy, you can order this book from the website. Now let me tell you the difference between this book and this master chart. This master chart is 60 pages. It's a calendar which you have to hang on the wall. And this book is approximately 800 pages book. Okay. So if you want to read, you can order the book and simultaneously watch the session and read the book, mark in the book. And if you want to hang it on the wall in a compacted manner, so this is the master chart. Information in this and this is same. This one is diffuse. This one is the compacted version of the same. So 800 pages of the book is compacted in 60 pages of the master chart. And both of them are available on our website. You can order them whatever you want. Okay. And the book is same as that of the notes, which are available along with this video. That book is same. So with this information, let me share my screen with you and start the session. We are starting central nervous system infections. Okay, we know we have divided human body into 9 systems. You can see these are the 9 systems. I have assigned one particular unique color code to each system. You know my way of teaching. You can see one color code is given to each system. Can you see? Okay, so today I am concerned with central nervous system. Central nervous system is assigned light green color. Now each system is divided into 5 portions. The syndromes in that system, bacteria, viruses, fungus, and parasites associated with that system. So currently I am concerned with the 5 things in central nervous system. So here is my master chart. You can see all the 5 things in central nervous system. Can you see this? Now in central nervous system, can you see the syndromes associated with central nervous system? There are 2 syndromes. Can you see the bacteria associated with central nervous system? There are 9 bacteria. Can you see the funguses and parasites associated with the system, central nervous system? There are 7 viruses and 7 parasites and only 1 fungus associated with central nervous system. So appreciate the 5 things: the syndromes, bacteria, virus, fungus, and parasite associated with central nervous system infection. Now you all are doctors. If any patient present to you with any of the CNS complaint, like the patient is having severe headache along with neck stiffness, with high grade fever, sensitivity to light, that is photophobia, severe nausea, vomiting, that can be related to central nervous system, confusion, altered mental status. So if any patient presents with any of the central nervous system symptoms and you are suspecting an infectious etiology, you must think all of these. So there are total 24 organisms. So if any patient is presenting with these symptoms, the symptoms which are related to central nervous system. So looking at the symptoms of the patient, you feel that CNS is involved and you are thinking some infectious etiology is there. It can be a bacteria, it can be a virus, it can be a fungus, it can be a parasite. So you must take all the 24 organisms in differential diagnosis. So these are the 24 organisms. Now based on the detailed history, symptoms, more science and lab diagnosis, we will come on conclusion what particular organism is involved in that particular patient and we can give the treatment accordingly. This is the approach. But differential diagnosis should include all 24 organisms. So first and the foremost step, before I start the detailing of the 24 organisms, you must know their names. Yes or no? So in central nervous system infections, in microbiology, we are having 2 syndromes and we are having 24 organisms. Among the 24 organisms, 9 are bacteria, 7 are viruses, 7 are parasite and 1 is fungus. So first of all, we will learn their names and then we will see the detail. So I will teach you all 24 organisms in 9 master charts. I will give you 3 master charts over here, 2 here, 2 here and 1 over here. So total in 9 master charts, we will pack the entire central nervous system infections. So before we start the master charts and the detailing of each organism, we will see an overview, a bird's eye view, right? Are you ready to take the tour with me? Yes. So let's start it. So first of all, have a look on the syndromes. How many syndromes are there? There are 2 syndromes. What are the 2 syndromes? Meningitis Encephalitis. Appreciate. Okay, I will teach you both meningitis, encephalitis. Then we will come on bacteria. How many bacteria are there? There are 9 bacteria. You can see these are the 9 bacteria. We divide the 9 bacteria into 3 categories. Okay, 5 of them cause acute meningitis. Okay, 3 of them causes chronic meningitis and 1 of them causes tetanus. Okay, so we will make 3 master charts. One master chart is for acute meningitis, the 5 bacteria causing acute meningitis. Have a look. See their name. It's Neisseria meningitis, Streptococcus pneumoniae, Streptococcus agalacti, Haemophilus influenzae, and Listeria monocytogenes. 3 of them causes chronic meningitis. Have a look. Mycobacterium tuberculosis, the same mycobacterium which causes pulmonary TB. Okay. Trypanosoma pallidum, the same trypanosoma which causes syphilis and STD, and Borrelia burgdorferi. These 3 causes chronic meningitis, and the one which causes tetanus, Clostridium tetani. So we will fill the details of these 9 bacteria into the corresponding master chart. So our bacteria will be ready. After that, we will come on viruses. Have a look on the viruses. There are 7 viruses. Have a look. Again, I will for the 7 viruses, we will make 3 master charts. One of them causes myelitis, poliomyelitis. Okay. 6 of them, 5 of them causes encephalitis. Encephalitis, you can see their name. And the last one is causing prion disease. So we will make 2 master chart. In one, I will include myelitis, the virus which causes myelitis, that is poliomyelitis. And in the remaining 2 master chart, we will take the one which causes encephalitis. Okay, you can see herpes, you can see JE, West Nile, Nipah, Hendra, rabies, and slow virus. Okay. After that, we will come on parasites. There are 7 parasites. And we will complete the 7 parasites into 2 master chart. You can see first I will teach you free living amoebas and the remaining all parasites which infect CNS. And finally, we will come on fungus. Only one fungus is there. The name of the fungus is Cryptococcus. Cryptococcus neoformans. We will complete it in the last. So to complete the 24 organisms, we are having 2 episodes today and tomorrow. Half of them we will complete today. The remaining half we will complete tomorrow. So let's start it. I am starting with bacteria. Bacteria are the biggest one. So in this episode, in episode 1, I will cover the bacteria, 9 bacteria. And in episode 2, I will cover the parasites, viruses, and fungus. I will cover 7 parasites, 7 virus, and 1 fungus. They are small in size. I mean, detail is less. But in first episode, we will cover the biggest chunk, the bacteria, all 9 bacteria. Okay. So before that, in episode 1, along with the bacteria, I will complete syndromes also. So in episode 1, we are completing 2 syndromes and the 9 bacteria in episode 1. In episode 2, I will cover the remaining all organisms, that is parasites, virus, and fungus. That is the approach. I hope you got the tour. You got the overview, bird's eye view. Now let's start it. Let's start with the syndromes first. Have a look. I will quickly complete the syndrome and then I will quickly complete the 9 bacteria. Okay, let's start the syndrome. There are 2 syndromes. What are the 2 syndromes? Meningitis and encephalitis. We will study them one by one. Let's start with meningitis. First, meningitis. What is meningitis? You can't understand meningitis unless and until you understand meninges. So first have a look in central nervous system. We are having brain and we are having spinal cord. Have a look. The brain and the spinal cord. Can you see? The brain and spinal cord is present in the central nervous system. Okay. In the central nervous system, in the brain and the spinal cord, 2 things are present. Brain parenchyma and the meninges. CNS parenchyma. Parenchyma is this. The main structure of the central nervous system is parenchyma. And meninges is covering. There are 3 covering. 1, 2, 3. That is known as meninges. The 3 coverings are known as 3 meninges. So first we will see the parenchyma. What are the cells that make the parenchyma? And then we will see the coverings. How many coverings are there? There are 3 coverings, 3 meninges. Okay. So the point is that if there is inflammation in the parenchyma, it is known as encephalitis. Encephalitis. And if there is inflammation in the meninges, it is meningitis. These are my 2 syndromes. What is encephalitis and what is meningitis? Encephalitis is the inflammation of CNS parenchyma. And meningitis is the inflammation of CNS meninges. You are getting my point? Have a look over here. So if there is inflammation of the parenchyma, it is known as encephalitis. And if there is inflammation of the meninges, these meninges get inflamed, it's meningitis. These are the two syndromes. I hope you got the difference between the two. First, we have a look, parenchyma mein how many cells are there? There are 3 types of cells in the parenchyma. What are the 3 types of the cells in the parenchyma? We have neurons. Neurons are the main cell that transmit the signal from here and there. The main cell in the central nervous system are neurons that transmit the signal. The supporting cell to the neurons are neuroglia. Neuroglia are the supporting cell. They support neuron. They are present around neurons and they support neurons. Okay. There are 3 types of neuroglia: astrocytes, oligodendrocytes, and ependymal cells. And the third cells are microglial cells. Microglial cells are the macrophages in the brain. The macrophages in the brain are known as microglia. Neuroglia are supporting cell. They do not transmit the signal, but they support the neurons which transmit the signal. There are 3 supporting cells: astrocytes, oligodendrocytes, and ependymal cells. So if inflammation is occurring in any of them, that is, inflammation is occurring in the parenchyma, it is known as encephalitis. Okay, and this is encephalitis. There are 3 types of cells. Suppose these are the neurons. Okay, supporting cell to the neurons is neuroglia. They are present around the neuron. They can be astrocyte, oligodendrocytes, or ependymal cells. And the third cells are the macrophages of the brain. That is known as microglial cell. They the main content of the central nervous system. Now coming on the coverings, as I told you, there are 3 coverings. There are 3 Meninges. What are the 3 coverings and the 3 Meninges? We have innermost layer. You can see this is brain and parenchyma. You can see this is central nervous system. The innermost one is pyometer. Appreciate. The innermost one is pyometer. Okay, which is adhered with the brain parenchyma. It is adhered with the central nervous system parenchyma. There is no space between the brain and the pyometer, spinal cord and the pyometer. There is no space. The second one, over to this, there is second layer, second covering, second membrane, that is known as arachnoid. And the outermost one, the third one, is known as durameter. And after that we have skull and vertebra. So you got the overview. What is the overview? So innermost we are having brain and spinal cord. Okay, this is innermost. Just a second. Innermost we are having brain and spinal cord like this. This is innermost. Okay, now there are 3 coverings. The innermost one is pyometer. This one is pyometer. I'm drawing with red color. The middle one is arachnoid. I'm drawing with blue one. And the outermost one is durameter. Okay, I'm drawing with the green one. And outer to all these, there is skull. Let me draw the skull. This is skull. Skull and the vertebra. Outermost to all this. Can you see? So these are the 3 Meninges. Appreciate it. Okay, pyometer, arachnoid, and durameter. Okay, so how many spaces are present? Can you appreciate the space? Okay, you see durameter. You see durameter. This is durameter. One space is above the durameter. One space is below the durameter. The space above the durameter is known as epidural space. And the space below the durameter is known as subdural space. So we are having 2 spaces. One above durameter, one below durameter. Have a look on the durameter. The space above the durameter is epidural. The space below the durameter is subdural. Okay, this is arachnoid. We have a space above the arachnoid is subdural. Below the arachnoid is subarachnoid space. Appreciate. There is subarachnoid space. This is subarachnoid space. And there is no space. Technically, you can see a space, but there is no space. This pyometer is adhered with the brain parenchyma. It is adhered with the spinal cord. So these are the 3 spaces. Can you say the 3 spaces? This one is epidural space. This one is subdural space. And this one is the subarachnoid. Epidural, subdural, and subarachnoid. Meningitis. Among the 3
Before
spaces,
we start
meningitis, you must know the composition of the normal CSF. How does normal CSF look like? Because when I will teach you the 3 type of meningitis, we will do CSF analysis of all the meningitis. So you must know inflammation about the CSF, the normal CSF. Any of the 3 can be. You can see this is the composition of the normal CSF. The pyometer and the CSF is durameter is rarely inflamed. It's clear. Inflammation like meninges is known as no turbidity. It's whenever there is meningitis, if you measure the pressure of the normal CSF in a test inside the brain or the spinal cord, it's 60 to 150 mm of water and to find out the cause of the meningitis. Does the normal CSF meningitis? We will do CSF. I'm asking you. Does the normal CSF you can appreciate yes or no? And you can see this is subarachnoid cell. It can contain the lymphocytes, not neutrophils. It can contain 0 how many meninges are there? So normal CSF can have 0 to 4. Middle one is lymphocyte. Okay, and per innermost is per microliter of the CSF. The pyometer is adhered to CSF, there can be up
durameter
to 4
is
lymphocytes.
just below,
More than
it
that,
is
it's
adhered to the
abnormal.
skull.
But up to
And
4
between
lymphocytes
the
is
two,
normal. But
there
even
is
a one
arachnoid.
neutrophil is
You
abnormal.
can see it here.
Neutrophils are never
Okay.
present in CSF.
Now,
Even
spaces I
single
told you,
neutrophil
one space
indicates
above durameter,
abnormality.
epidural,
What about the
one
normal
space
protein
below
and normal
durameter,
glucose?
subdural,
CSF
and
contains
one space
protein
between
as well as glucose. So how
arachnoid
much protein and how much
pyometer.
glucose?
The space
Protein
between
is
arachnoid
15
and
to
pyometer
45
is
milligram
known
per
as
deciliter,
subarachnoid space.
and glucose
It
is
is known as
50 to
subarachnoid
80
space.
milligram per
Okay.
deciliter. So
Can we
please
continue?
learn the values,
So,
because when
that
you
is
get
the
the
thing.
clinical questions, MCQ questions in your exam, they give you the value. So if you don't know the normal value of CSF glucose and CSF protein, you cannot interpret whether in that question the protein is increasing or decreasing, glucose increasing, decreasing, or it's normal. So learn the normal. Learn protein, it's 50 to 50. For the sake of learning, you can say 15 to 50 milligram per deciliter, and this one is 50 to 80. So protein, glucose. Protein is 15. I'm sorry. Protein, glucose. Protein is 15 to 50 milligram per deciliter, and glucose is 50 to 80 milligram per deciliter. So this is the composition of normal CSF. Okay, now let's start meningitis. You are ready to start the meningitis, right? What is meningitis? Itis in pathology is the inflammation of that organ. Meningitis is the inflammation of meninges. Okay, you can see the 3 meninges. If they get inflamed, it is meningitis. You can see this is meningitis. The meninges get inflamed. The covering get inflamed. The brain parenchyma is not inflamed. If the brain parenchyma is inflamed, it's encephalitis. That I will teach you after this. But if the coverings are inflamed, it's meningitis. You can appreciate the 3 meninges. The 3 meninges are inflamed by various organisms. It is leading to meningitis. Appreciate the meninges are inflamed. You can appreciate the 3 meninges are inflamed. Appreciate the meninges. Meninges are getting inflamed. It's meningitis. Okay. But meningitis is caused by the organism. It can be a bacteria, it can be a virus, or it can be a fungus. Parasites are not causing that. So if the meningitis is caused by the organism, how does organism reach to the meninges? What are the routes? If a bacteria, virus, or fungus is causing the meningitis, the coverings, how does the organism is reaching till here? So what are the routes? There are 3 routes. Blood goes everywhere. Suppose the blood contain any of the organism, maybe bacteria, maybe virus, or maybe fungus. Via blood, it can reach the meninges and causing the inflammation of the meninges. Most common route is blood route. Most common route is blood route. Okay, number 1. Number 2, from the adjacent focus. Okay, now meninges, the brain is connected to the ear, to the eyes, to the base of the skull. So base of skull, ear, eyes, if any of them have inflammation, any of them is having infection, the organism can directly involve the meninges. So from the adjacent organs. Okay, and third is etiologic. What do you mean by etiologic? While performing lumbar puncture. You know, we perform lumbar puncture to take the CSF out. So we want the CSF for diagnostic purpose. We are taking it out. For that, we are performing lumbar puncture. For that, we are inserting lumbar puncture needle into the meninges to suck, to take, to aspirate, to aspirate the CSF out in a test tube. So this needle should be sterile. If we are performing lumbar puncture with a non-sterile technique, this lumbar puncture needle is not sterile and we are inserting, the doctor, the physician is inserting the organism inside. So that is known as etiologic. Etiologic means physician induced. Who has given this organism in the meninges? Physician. Physician was doing the lumbar puncture and inserting the needle, but the needle was not sterile, and via the needle it can reach and cause meningitis, reach up to the meningitis. You can see lumbar puncture. This is how between L4, L5 vertebra, you can see here L4, L5 vertebra, the needle is inserted to aspirate the CSF out. You can appreciate this is how we are inserting it. You can see a real diagram. First we follow complete aseptic technique and then only we insert. You can see in reality it's like this. Okay, in reality it's like this. You can appreciate. We are inserting the LP needle. It is known as LP needle, lumbar puncture needle. We should perform lumbar puncture using complete sterile technique. Okay, if you are not following the sterile technique, the person can have meningitis. If the needle is contaminated or hands are contaminated or the skin is not thoroughly cleaned, that can lead to that. So these are the 3 routes, you know. So till now I taught you the definition of meningitis, the routes of meningitis. Okay, now I will teach you types of meningitis and we will see the description of each type. The definition we already know, it is the inflammation of meninges. The routes we already know, there are 3 routes. The first route is blood route, that is hematogenous. Second is direct from the adjacent organs. And third is etiologic. Etiologic means physician induced. Now let's come on the types of the meningitis. How many types of meningitis is there? There are 3 types of meningitis. Okay, what are the three types of meningitis? The one which is caused by bacteria, the one which is caused by virus. Okay, third I will tell you. Okay, the one which is caused by bacteria is always acute. The one which is caused by virus is also acute. Okay, the one which is caused by bacteria, it is known as acute pyogenic meningitis or bacterial meningitis because bacteria form pus. The one which is caused by virus, it's also acute, but it is known as acute lymphocytic. Acute lymphocytic meningitis. Acute lymphocytic because here lymphocytes are raised. So learn, this one is acute pyogenic bacterial. This one is acute lymphocytic viral. And the third one is chronic meningitis. The third meningitis is chronic. You say, ma'am, if it's chronic, is it by bacteria or virus? It is by one of the fungus and one of the bacteria. There is one bacteria and one fungus who cause it. Name the bacteria. The name of the bacteria is TB. Mycobacterium tuberculosis, and the name of the fungus is Cryptococcus. So chronic is of two types. What are the two types? Tubercular meningitis and cryptococcal meningitis. These two are chronic. So say the three type of meningitis. What are the three type of meningitis? Say, ma'am, one of them is bacterial, second is viral, and third is tubercular or cryptococcal. Okay, one bacteria, one fungal. Now which one is acute, which one is chronic? This one is acute. This one also acute, and this one chronic. Now say their other names. Can you see their other names? This one is known as pyogenic meningitis. Acute pyogenic. This one is known as lymphocytic. Acute lymphocytic meningitis, also known as aseptic meningitis. Acute aseptic meningitis. And this one is tubercular or cryptococcal meningitis. Okay. So I hope you got it. Now see the three types. You can see acute, chronic. Okay. Bacterial, viral, tubercular or cryptococcal. And see their other names. The bacterial is pyogenic. The viral is lymphocytic, also known as aseptic. I hope you got the three types. You can see we will make this master chart. I call this master chart as meningitis master chart. You can appreciate the bacterial meningitis, viral meningitis, and tubercular meningitis. You can appreciate the three type of meningitis. And this one is normal. Normal CSF composition we have already seen. Now we will see one by one the meningitis, how CSF is changing, and we have to compare it with normal. How CSF is changing. And based on this, we can differentiate the three type of meningitis. So if any patient presents to your clinic with meningitis, the first thing you have to do is lumbar puncture. Okay, and CSF tapping. We have to take the CSF out. We have to aspirate the CSF. We have to tap the CSF via doing lumbar puncture. So based on the finding, we will decide, is it bacterial or viral or tubercular or cryptococcal? Because treatment is different. People, please see, if it is bacterial, you will give antibiotic. If it is viral, you will give antiviral. If it is tubercular, you will give DOTS. And if it is fungal, you will give antifungal. I mean, if it's cryptococcal, you will give antifungal. Treatment is entirely different. You cannot treat them all. Okay, that's why CSF tapping is utmost important for diagnosis and differentiating which type of meningitis is it. So let's start the first one. The first one is acute bacterial, pyogenic. Acute bacterial one. Let's start it. The first one. We will compare this one with the normal. Let's start it. What are the bacteria which cause it? Tell me the etiology. So bacteria can be different. In neonates, it's caused by Streptococcus. Group B Streptococcus, that is Streptococcus agalacti. In neonates. Okay, from 1 month onwards till 3 years. In children, it is caused by Streptococcus pneumoniae. From 3 years onwards, it's caused by meningococci. Till 20 years, and overall after 20 years in adults it's again pneumococci. So the organism depends on age. You have to learn total 3 organisms are there: Streptococcus agalacti, pneumococcus, meningococcus, and H. influenzae is also there but rarely. E. coli is also there but rarely. So you have to learn for your MCQ purpose which organism is causing meningitis in which age group. What is the common organism which is causing meningitis in neonate? Okay, up to 1 month, 1 month to 2 month to 3 year. From 3 years to 20 years and more than 20 years. So you have to name the organism. You can see this is the organism. The organism may be different. It can be Streptococcus agalacti. It can be Streptococcus pneumoniae. It can be Neisseria meningitis. Okay, so these are the organism. Now coming on the symptoms, clinical features. In clinical features, we have 2 things, symptoms and signs. So what is symptom? The patient complaints are symptom. What the patient is saying to the doctor is symptom. What the doctor is examining in the patient is sign. So what are the symptoms of meningitis? Acute meningitis, bacterial meningitis. What are the signs of bacterial meningitis? One by one we will see. Symptoms, it's a medical emergency. The bacterial, acute bacterial pyogenic meningitis. It's a medical emergency. Okay, patient presents with headache, fever, severe headache, high grade fever. The most important finding is neck stiffness. The person is having stiffness of the neck. Okay, neck stiffness and changes in the mental status. So patient is having high grade fever, severe headache, neck stiffness, vomiting, sometimes goes in coma and convulsions, changes in the mental status. These are the symptoms of all meningitis, and all meningitis symptoms are same, but the severity is highest in pyogenic one, bacterial one, because here pus is formed in the meninges. Okay, so very severe. It's a medical emergency. Coming on the signs, we are having two signs to deal here. What are the two signs? Brudzinski sign and Kernig sign. One by one, I will let you know. What is Brudzinski sign? Have a look. What is Brudzinski sign? What is Brudzinski sign? Flexion of neck. Okay, this is the examiner. Suppose I am the doctor over here. You can see this is the doctor. This is the examiner. So examiner is flexing the neck of the patient. Okay, so there is involuntary flexion of the hip and involuntary flexion of the knee joint. Involuntarily, whenever the neck is flexed. Why it is happening? Because here meninges are there which are having pus which is inflamed. The meninges are there. Okay, the meninges are covering the brain as well as spinal cord. They are inflamed. They have pus in them. So whenever we flex the neck of the patient like this, the meninges get irritated. It is known as meningismus. They get irritated, and because they get irritated, there is involuntary flexion of the hip joint. Appreciate the hip joint and the knee joint. So involuntary flexion of hip and knee joint on flexing the neck. Examiner is just flexing the neck, not touching the knee and hip, but involuntary flexion of the knee and the hip joint is known as positive Brudzinski sign. It is seen in bacterial meningitis. Okay, pyogenic meningitis. You can appreciate it. Ask the patient to lie down supine and just flex the neck. See the hand of the examiner. You have to draw this diagram. You have to draw this diagram in your exam. This is the hand of the examiner. Flex the head, flex the neck. You can see involuntary flexion of the hip and the knee. This is positive Brudzinski. Second is Kernig sign. Second sign is Kernig sign. Again, ask the patient to lie down supine. Ask the patient to lie down supine with hip flexed at 90 degree. We are flexing the hip at 90 degree. First, ask the patient to lie down supine, then flex the hip at 90. Can you see hip joint? This is hip joint. I'm flexing it at 90 degree. And after that, I'm taking the leg upwards. I cannot take it upwards. The lower leg cannot be extended because of pain and resistance. See, I'm trying to do so, but patient is resisting. Patient not able to take the leg up. This is Kernig sign. You can appreciate. So we are asking the patient to lie down and making the hip joint at 90 degree and taking leg upwards. But see, we cannot take it complete upwards. Okay, so because there is resistance. This is Kernig sign. So two signs I told you here, Brudzinski sign and Kernig sign. So learn the symptoms, learn the signs. Okay, so if any patient coming to me with the symptoms and with the signs. The symptoms is a medical emergency. Patient is having fever, headache, nausea, vomiting, neck stiffness, and mental status, altered mental status, confusion, coma, seizures. So I'm having I'm suspecting that the patient is having acute pyogenic meningitis. I will examine two signs, Brudzinski sign, Kernig sign. Both of them are positive. So I am having still high degree of suspicion that the patient is having bacterial meningitis, pyogenic meningitis. How should I confirm? I will do the lab diagnosis. What sample should I take? Shall I take blood sample? Shall I take stool sample, saliva sample? No. I will take only one sample, CSF. I will tap the CSF out. I will do the lumbar puncture. So via doing lumbar puncture, we are taking the CSF out. Here is the CSF. You can see this is the CSF. Appreciate it and compare it with the normal. So normal CSF, you can see this table. Normal CSF is clear and colorless. But here the CSF become cloudy and purulent, looking like the pus. Appreciate the normal CSF was looking like water, but here the CSF look like pus because it contained pus. It's turbid, it's purulent. Okay, normal CSF pressure is having 150 mm of water. Here it's up to 180, slightly elevated. Instead of 150, it is having 180 mm of water. Okay, normal CSF have cells? Yes, they have lymphocyte. How many? 0 to 4. 0 to 4 lymphocyte per microliter. Here neutrophils will be there. How many neutrophils? 100 to 10,000. 100 to 10,000 neutrophils per microliter. Okay. Now here glucose is reduced and protein will be elevated. Glucose will be less than normal. Protein will be more than normal. What is the reason for the two? See. This is a test tube containing the CSF of a patient. This is CSF of a patient in which I am suspecting there is bacterial meningitis. I'm not sure. I'm suspecting. Suppose my suspicion is right. It contains bacteria. It contains bacteria. It can be Streptococcus agalacti, Streptococcus pneumoniae, Neisseria meningitis. I told you the etiological agents. It can be any of them. This is the cell wall of the bacteria. All bacteria have cell wall. This is the cell wall of the bacteria. Now, bacteria eat glucose. So, whatever glucose present in the normal CSF, what is the range of normal glucose? In a CSF, the normal glucose is 50 to 80 milligram per deciliter. That is eaten by the bacteria. Bacteria consume glucose. Most of the glucose is consumed by the bacteria. So if you measure the glucose now, it will be less than normal. Glucose is less. This is the reason. Okay. And what about the protein? You know, all bacteria have cell wall. Cell wall is made up of protein. Cell wall is made up of protein. So this cell wall, these bacteria will die, some of them, and cell wall will come in the CSF. So if you measure the protein component of the CSF, it will be high. Normal protein is already there, which is 15 to 50 milligram per deciliter. It is including the extra protein which is coming from the cell wall. So whenever the person is having pyogenic meningitis, and if you measure the glucose and the protein of the CSF, glucose will be less, protein will be more. Glucose less because it is consumed by the bacteria, and protein more because the cell wall is contributing in the protein. Okay, so I hope you got it. So these are the CSF findings. And if you do the gram staining, you will get the causative organism. Gram positive or gram negative. So these are the CSF findings. First, C, appearance, it's cloudy. Okay, CSF pressure slightly elevated. If you see the cells, neutrophils are there, 100 to 10,000 per microliter. Protein will be high and glucose will be low. And you will get the causative organism. Okay, you can see we are making a smear. Okay, on the Newbar's chamber, we are taking the CSF. And which cells we can see? You can see all the cells are neutrophil. Appreciate they all are multilobated. They all are multilobated. Appreciate they all are neutrophil. This is acute pyogenic meningitis. Coming on the second one. The second one is acute lymphocytic meningitis. Let's come on acute lymphocytic meningitis, the viral one, second one. So many viruses can cause that, but the most common virus is enterovirus. Please learn. Most common virus is enterovirus. Although many viruses can cause that, but the most common is enterovirus. Apart from that, mumps, ecovirus, Coxsackie, Epstein-Barr virus, herpes simplex virus, orthopod-borne virus, HIV can involve. But most common is enterovirus. Okay, clinical features are same as that of bacterial, but less severity. Severity is not much high. So patient have fever, headache, neck stiffness, change in mental status. Symptoms are same. Now tap the CSF. Symptoms are same. Tap the CSF, see the CSF. So in the CSF, normal it was clear. In bacterial meningitis, it was cloudy, purulent. Here again, it's clear. It's clear like normal. No cloudy, no purulent, because viruses don't form pus. Bacteria form pus, but virus don't form pus, so it's clear only. Okay, here pressure was 150. Here pressure is 180. And here pressure is 250. So here pressure is more, 250 mm of water. What about the cells? Normally we have lymphocyte. In bacterial we have neutrophils. Here also lymphocyte. It's like normal only, lymphocytes. But the range of the lymphocyte here is 0 to 4 per microliter. And here it's 10 to 100 per microliter. Up to 4 it's normal. Here it is more than 4. Up to 100 lymphocytes are there. Okay, glucose normal, protein normal. Viruses don't eat glucose. It's normal. Viruses don't have cell wall. So protein is also normal. And if you do the gram staining, you don't get anything. Viruses don't take gram staining. I hope you got it. So only thing to find the virus in a test tube, in a CSF, is to make the smear and see the cells. You can see here, the CSF is clear, looking like water. Take it on Newbar's chamber and see which cells are there. These all cells are lymphocyte. They are not neutrophil in contrast to bacterial one. They all are lymphocytes. Okay, coming on the third and the last one. The third and the last one is chronic meningitis. Can you see? Yes. The third and the last one is chronic meningitis. What is a gross? Grossly, you can see there is cobweb appearance. I will show you here. You can see. Okay, before that, etiology. Chronic is caused by whom? You tell me who causes chronic? It is one bacteria, one fungus. The name of the bacteria is Mycobacterium tuberculosis. And the name of the fungus is Cryptococcus neoformans. The Mycobacterium tuberculosis causes tubercular meningitis. And Cryptococcus causes cryptococcal meningitis. Okay. Symptoms are same. Symptoms are same. There is nothing this. The symptoms are same. Okay. If you see the gross appearance, you will see a cobweb appearance. What do you mean by cobweb appearance? Appreciate this cobweb. Appreciate the cobweb appearance. Okay. If the CSF is standing for a long time in a test tube, and if it contains Mycobacterium tuberculosis, not Cryptococcus, Mycobacterium tuberculosis. Mycobacterium tuberculosis form fibrin bands in the CSF. fibrin bands in the CSF. These fibrin bands look like the cobweb. These fibrin bands look like cobweb. This is known as cobweb appearance. Okay, this is known as cobweb appearance. It is seen only in tubercular one. Okay, number one. So that is the thing. Here you can see. Second, you can compare it here. Let me show you the table. In the table, you can compare. Here the normal CSF is clear. In bacterial one, it is turbid, cloudy, looking like the pus. In viral one, again, it's clear. And here in chronic, if it is tubercular, it will form the cobweb. If it is cryptococcal, it will be clear only. Here pressure is 150. Here it's 180. Here 250. Here it's 300. Highest pressure, 300 mm of water. See the cells. Here we have lymphocytes. Here neutrophil. Here again lymphocytes. Here also lymphocytes. So here only we have neutrophils. Neutrophils are present only in the bacterial one. Remaining all three have lymphocytes, but you see the range of the lymphocyte. Normally 0 to 4 lymphocyte per microliter. In the viral one, we have 10 to 100 lymphocytes per microliter. And in the chronic one, tubercular or cryptococcal, we have 100 to 1000 lymphocytes per microliter. Okay, here also glucose is reduced because TB eat glucose. Here also protein is elevated because TB bacteria have the protein cell wall. I mean, have the cell wall that will contribute for the protein. And you have to do a special stain. For if you're suspecting TB, you will do ZN stain and you will get the organism. You know, on ZN stain, the TB bacteria looks like the red rods. Appreciate the red rods. And if you're suspecting Cryptococcus, do a India ink. India ink negative stain. If it is Cryptococcus, you will get the black stain, and on a black stain, the organism is highlighted. The Cryptococcus is highlighted. So how to differentiate between the two chronic? There are two causes of chronic. What are the two causes of chronic? TB and Cryptococcal. To differentiate them, we have to apply special stain. If you are suspecting TB, apply ZN stain. If we are suspecting Cryptococcus, apply India ink. This is how we will do that. So we will apply the special stain. I hope we are done. The three type of meningitis in front of you. Appreciate. So please do appreciate their naked appearance. Come on, naked appearance. So normally it is normal, clear, like a water. Here it's clear like water. In the bacterial one, it's purulent and cloudy like the pus. Here again clear. And here in case of TB, it form a cobweb on standing, the fibrin band. Tell me the pressure. Normal pressure is 60 to 150 mm of water. Here up to 180 mm of water. Here up to 200 mm of water. And here up to 300. Here 250 mm of water and here 300 mm of water. Tell me the cells. The most important is cells. Lymphocyte, neutrophil, lymphocyte, lymphocyte. Say the number. Here 0 to 4 per microliter. Here 100 to 10,000 per microliter. Here 10 to 100 per microliter. And here 100 to 1000 per microliter. Please learn that. What about glucose? You know the normal range of glucose. Normal range of glucose is 50 to 80. Okay, milligram per deciliter. And protein is 15 to 50 milligram per deciliter. Here glucose less, protein more. Here also glucose less, protein more. You know the reason. Because bacteria is consuming glucose and the cell wall of the bacteria is contributing for the protein. But in virus one, both are not. Okay, and we will do special stain. Here we will do gram stain. Here nothing will work. Okay, and here we can do ZN stain and India ink. ZN for the TB and India ink for the Cryptococcus. So first of all, whenever it's a patient with meningitis, take the CSF out. If you're getting these findings, start antibiotic. If you're getting these findings, start antiviral. If you're getting these findings based on ZN or India ink, decide is it tubercular or cryptococcal. If it is tubercular, start dots. If it is cryptococcal, give antifungal. So we are done with meningitis. I hope you got it well. Okay, coming on encephalitis. Encephalitis. I told you what is encephalitis. Meningitis was inflammation of the three meninges. Okay, you know the three meninges, pyometer, arachnoid, and durameter. Encephalitis is inflammation of the brain parenchyma. Inflammation of the brain parenchyma is known as encephalitis. The brain parenchyma is inflamed. Encephalitis. The brain parenchyma is inflamed. Okay, that is encephalitis. What is encephalopathy? This is encephalitis, the inflammation of the brain parenchyma, not of the meninges. Encephalopathy, everything is normal, but there is some problem in the metabolism of the brain. It's a disease in which brain function is altered. Structure, there is no change. The functional change is there. Encephalopathy. The clinical features are same as that of meningitis. Patient have fever, altered level of consciousness, seizure. Here psychiatric symptoms is additional, which was not there in meningitis. Focal or diffuse neurological signs is additional, which was not there in meningitis. The features of meningitis is also there. Meningismus, neck rigidity. All these features are same. These are the causes of encephalitis or encephalopathy. You can see these are the causes of encephalitis. These are the causes of encephalopathy. Don't go them in detail. Just see the superficial names. CSF analysis is same as that of viral meningitis. There are three types of meningitis now: bacterial, viral, and chronic. That is tubercular or cryptococcal. Chronic. So in encephalitis, it is equivalent to viral meningitis. The CSF finding. What were the viral meningitis finding? You tell me. Which cells were elevated? Lymphocytes. So here also lymphocytes are elevated in the same range as that of viral meningitis. We have lymphocytic pleocytosis. Protein is normal, glucose is normal, almost normal, or mildly elevated, or you can say normal, like the viral one. So in encephalitis, the findings are same as that of viral one. So we are done with the two syndromes. People, we are done with the two syndromes.